Hi, everyone. I'm Dr. Mark Trolice. I'm a reproductive endocrinology and infertility specialist in Orlando, Florida. And it is my honor to be with you all virtually to talk about ovarian aging. Now, this conference put on by IVF Babble is so valuable, and I truly admire their efforts and also all of you fertility warriors to be your own advocate and reach out to get all the information that you need to guide you on your path to parenthood. Today, I wanted to talk about the biologic clock. All women, all women who desire having a child at one time in their life think about the limited potential to be able to have children due to ovarian aging. This talk is going to give you the information that you'll need to make the right decisions for you, hopefully. So the initial objectives are to present normal reproductive biology, not too much science, but with an emphasis on the ovary so that you understand what your biology is. We're going to discuss ovarian aging, what that means for your fertility as well as your general health, and then offer ways to what I call stay ahead of the clock using natural and medical methods. So what are the numbers? Well, this is from the United States, and I know this is an international conference, but in the US, about 6 million women are experiencing infertility, and about 1 million seek care, and 5% use in vitro fertilization. I know that varies in countries, but in this country, about 5%. As a matter of fact, the births in this country is about 1 to 2% or so for IVF live births compared to all the other births for natural methods. So as a woman gets older, the percentage that they will experience infertility increases. Okay, so for all couples, somewhere around, I know this slide says 1 in 10, we'll say about 1 in 8. In the age group, as a woman gets older, you see 1 in 7, then 1 in 5, and in above age 40, I've seen even statistics showing 1 in 3 or higher. And certainly as a woman gets older, the miscarriage rate will increase. So do you have time? And what is the true reading of your clock? Okay? Women are all concerned about this. And this is the most common question I get and the most anxiety-provoking question I get. Am I too old to have a child? When should I start getting aggressive to have a child? All of those different questions we'll answer today. So as over the last maybe 3 to 4 decades in the US, you're seeing a significant decline in the numbers of births, okay, from a peak in the mid-1950s with the baby boom, okay, per 1,000 women. And then you're seeing now significant stabilization as well as decline up to these numbers up to 217. So the birth rate has shifted as women are delaying childbearing for several reasons that we'll talk about. Okay, so you'll see 25 to 29 years ago was much, much lower, and 25 to 29, 30 to 34, these are the peak ages, okay, and this has gotten older in the country that shows that women are delaying childbearing, the average age, okay? And then, of course, as women get older. But we're going to see in these later reproductive years what that actually means. This is showing the birth rate per 1,000 women. And women age 15 to 44, it is essentially plateau as well as going down toward more recent, okay? But in women 35 to 39, as well as 40 to 44, they are increasing. So it's showing that as women are getting older, that's the age because they're delaying childbearing, okay? So is IVF the answer? Well, what happens with IVF is reflective of women's reproductive potential, okay? So these are statistics from a while back, but still they apply because it's not the actual numbers that are, it's the trend that I want to share with you, is that as women get older, the chance of a live birth is going to continue to decline with in vitro fertilization, as well as miscarriage increasing. So why the fuss? Well, childbearing average age has increased now. Women are waiting to have children over the last 3 to 4 decades. Why is this happening? Well, more women are pursuing higher education and careers, as well as waiting and for a partner or a marriage. They haven't found the right person yet to have a child. And we also have to remember that there is a limited number of eggs during a woman's lifetime. It's estimated anywhere between 350 to 500 eggs are actually ovulated. But let's talk about this a little bit more close. So what is your chance of natural fertility? Okay. Do we have to be so concerned that as a woman gets older, it's not going to happen? And the short answer, of course, is no. Women can still have baby in their 40s. Okay. But let's look at this. Now, this column is looking at the average monthly pregnancy rate per age, and then the cumulative pregnancy rate in 6 months and then a year. Okay. So at age 30, close to 20%. And after a year, close to 90% of women are going to get pregnant. Say a woman in their 40s now, okay, 40 to 41, less than 9% chance per month, but within 6 months, close to 50%, a little bit more than 50% after a year. And then, of course, a little bit lower, obviously, as a woman getting older. But what I wanted to underscore with this slide is that getting older does not mean that you cannot conceive. It does potentially take longer because of the lower monthly pregnancy rate, but all things being equal, you're seeing in the early 40s, about 50% of women are still going to conceive up to a year if everything else is normal, okay? So the biology is such that when you were inside your mom, you're talking about 7 to 8 million eggs, roughly about 20 weeks of pregnancy, okay? And then when you were born, at birth, you're dealing with born with about 1 to 2 million eggs. At puberty, 200 to 400,000. At age 37, you'll see about 10,000, and then near menopause, 1,000, and then of course menopause. There's no further eggs. So numbers of ovulations, as I shared with you, about 350 to 500, and the reason why you lose these eggs are from a phenomenon called apoptosis. Okay, it's a programmed cell death that is just the destiny. Every single month, hundreds of eggs are getting ready to ovulate. Only one makes it. The rest die off. Okay? So this is the reason why. And that happens on birth control pills. And with pregnancy, you're still going to lose eggs. So age and reproduction. What are the implications? Okay? Fertility rate's going to go down, which we showed. Miscarriage rate, when you're less than age 30, you're dealing with about a 10% risk of miscarriage. Above age 40, at least 33%, if not higher. Okay. Your response to fertility medication is going to go down. The risks in pregnancy will increase. As a woman ages, particularly in their 40s, you're seeing higher rates of high blood pressure, diabetes, unfortunately even stroke. Okay, a little bit higher. What I mean by medication response, just to go back to that, is that giving you injectable fertility medication will have a lower number of eggs as you get older in general compared to when you were younger, mature eggs that are being produced. I mentioned also the bottom two, chromosomal issues. As a woman gets older, the likelihood of her having a chromosomally abnormal embryo is much higher. And of course, the risk of Down syndrome and other chromosomal issues at birth increase. So say at 35 years of age, Down syndrome risk is about 1 in 365 pregnancies. At age 40, it's about 1%. And then I mentioned, of course, the medical complications during pregnancy. So what causes diminished ovarian reserve, or at least what's the risk factors? Well, the first one, as you can see, I can't emphasize enough. Cigarette smoking accelerates the loss of your eggs, and women go into menopause sooner. They actually have lower fertility, higher rates of miscarriage, as well as higher rates of an ectopic pregnancy, which is a pregnancy located outside the uterus, often in the fallopian tube. Now that will require medical treatment and sometimes even surgery because it's potentially life-threatening. Another risk factor is if your mom or sisters went into early menopause. Okay, we now call early menopause. We used to call it premature ovarian failure, but we now call it primary ovarian insufficiency. The next one is ovarian or extensive pelvic surgery. And this is because of diminishing blood flow to the ovaries, okay? So removing an ovary or extensive surgery on an ovary, you're going to be losing lots of eggs, okay? Uterine surgery, particularly if a woman has had a hysterectomy, okay? Now, obviously, she would need a gestational carrier, but that diminishes blood flow to the ovaries because the uterus and ovaries share blood supply. Significant ovarian disease can cause that, as well as, of course, cancer and cancer therapy, chemotherapy, particular types of chemotherapy drugs, as well as, of course, radiation to the ovaries. So those are the important risk factors that you need to be made aware. But sometimes it's also unexplained, which is very, very frustrating. So the way we do ovarian age testing, we look at quality and quantity. All right? Quality of eggs is always going to be based on a woman's biologic age. In other words, your birthday. Okay? The more aging of a woman, the lesser the numbers of eggs. And we saw that slide earlier, okay? But quality is much more important than quantity. So when you do quantity measurements, hormonal measurements, we'll talk about AMH and FSH, or measuring the numbers of small little cysts on the ovary called antral follicle count, that's quantity. But if you're younger and you have the poor quantity of eggs, you'll still do better because of the younger age than as if you were older, okay? So quantity, we're going to talk about a little bit more now, all right? That is measured by hormones and ultrasound. Antimullerian hormone is now really the standard of care for measuring the numbers of eggs that a woman has. AMH, these are produced in the granulosa cells, the cells surrounding the developing follicle cysts. Those are with microscopic eggs, as well as pre-antral follicles that are just getting ready to start growing in the ovary, okay? So that's where AMH is coming from. And obviously, the lower the numbers of eggs, the lower the cells. The lower the cells, the less AMH is being produced. The bottom graph that you could see is as a woman is maturing in her early to age 30, her AMH is increasing, and then you're going to start seeing a slow and steady decline. The average loss of ovarian eggs and AMH is about 5% per year, okay? So very important to realize that AMH is produced from the ovary, the cells around the eggs. But I will share with you, it is not a predictor of natural childbirth. In other words, natural conception, rather. Women, they did a study in the Journal of the American Medical Association that was published. Women ages 30 to 44 were followed. Poor AMH versus a normal AMH. And they had the same pregnancy rate year to year, okay, comparatively, which means that AMH does not predict your natural ability to conceive. It does have an impact on your success rate with IVF because IVF is improved with the more eggs that you produce. And as your AMH goes down, the less eggs, and the less eggs, the lower the success with in vitro fertilization. This is talking about FSH, okay? FSH we used for years, but it really is not as valid, or rather reliable a marker, I'll say, okay? So FSH is produced, it's the red line. FSH is produced from the pituitary gland, signaling the ovary to start growing a follicle. Lots of follicles hundreds start trying to grow. Only one becomes dominant, the rest die off, okay? And FSH starts lowering because of the feedback from the ovary, from the hormones estradiol and even more so inhibin B, okay? But we measure estradiol in a woman's response to the fertility medication. That's what you're doing during your IVF cycles. So what I'm looking to say here is that FSH is not reliable because it can fluctuate month to month. A high FSH, yes, very reliable that you're dealing with significant ovarian aging. But a low FSH just is a low FSH. It can vary from month to month, okay? And it has to be drawn. The blood test has to be obtained on menstrual cycles day 2 3, or 4, because that's the highest that your FSH will be in a regular menstrual cycle. Not valid any other day in the cycle. If you draw the blood test at the time of ovulation, it actually can be very high, which is normal, although some people would get alarmed if they didn't realize that it wasn't done at the right time. Okay? But FSH is truly outdated now. It has been replaced by AMH. And AMH actually shows ovarian aging years before FSH starts going up. So can we get an idea about AMH and antral follicle count and FSH based on age? Well, I wouldn't put these numbers in locked in, okay? But just in general, as a woman gets older, AMH is going to go down, FSH is going to go up, and the antral follicle count is going to go down, okay? What we consider a normal antral follicle count, and we're going to show you what that means, but more than 11 are combined from the ovary. Less than 6 is pretty severe. So the antral follicle count, when you see a normal ovary on ultrasound, those black circles are typically less than 10 millimeters, okay? And we see them and we count them. And the numbers are your antral follicle count. Now, not everyone is going to grow into a dominant follicular cyst with an egg if we stimulate you, like during in vitro fertilization. But it gives us an idea how to stimulate you. For example, a polycystic ovary syndrome patient has lots of those little follicles, okay? So they hyper-respond to fertility medication. A woman who doesn't have as many is going to need more medication to respond, okay? So it's important to know that the best indicators are AMH and antral follicle count for ovarian age. So in general, what are we considering significant ovarian aging? People would argue about the level of AMH, but certainly less than 1. I've seen 1.6, 1.5, things like that. But less than 1 is definitely concerning. Less than 0.4 is severe. Antral follicle count, less than 6 is severe. Less than 6 is severe. FSH levels above 10. Now these are assay dependent, in other words, laboratory dependent. But when you start getting levels that high, definitely concerning. If you go through an egg retrieval and get less than 4 eggs, people have used that as a definition, and as well as primary ovarian insufficiency less than age 40, okay, which is essentially ovarian failure. But with ovarian failure at a younger age, 50% of patients will have sporadic ovulation, and 5 to 10% of them can actually have a pregnancy and a baby. But of course, there's no way to rely on that or predict a woman returning. Now, don't want to forget about the man. More and more evidence is showing that fertility counts are declining over the years, and particularly in women in men above age 40. So fertility rates are going down. Miscarriage rates are going up. The woman is a higher risk of preterm birth, not understanding that, but there is an association there. But also, higher rates, 4 to 5 times higher rates of autism and schizophrenia in the offspring, as well as, unfortunately, birth defects. So men are not removed from the concern about ovarian aging, okay? So what are ways that you can beat the clock? Well, as we talked about earlier, please stop smoking if you are. If you're not, don't start. But please stop smoking, including vaping, okay? Have children if you could, obviously before age 35. Fertility rates start to decline around age 30 to 32, okay? If you're very, very concerned about delaying your fertility, it's important to have a very thorough consultation with a reproductive endocrinology and fertility specialist about the pros and cons of freezing your eggs. Ovarian tissue freezing is something that we do. It's now not considered experimental, but it is often we use it for cancer patients who need an emergency retrieval of their eggs, and certain circumstances may allow it easier to get it from the ovary, particularly in prepubertal girls. But also if the woman has a partner, then freezing embryos would be more ideal than freezing eggs. Another way to beat the clock is to know your family history of menopause. If your sisters and your mom all had early menopause before age 40, that's something that you really want to pay attention to and move up your timetable for childbearing. So if you've reached a point that it is becoming extremely difficult to have a child because of severe ovarian aging and or early menopause, which we call primary ovarian insufficiency, donor egg is very, very successful. Now, this is not something that is easy all the time for patients to accept. Actually, rarely patients immediately embrace this unless really they've known for a long time that they're going to need that. In other words, they lost their ovaries at a very young age, or a loss of ovarian function at a very young age, if they've had the opportunity to know that they're going to be using donor egg when they get older. But for the patient who's been trying to conceive biologically and then their doctor says, I really think donor egg would be better for you, that's hard. And so we understand and we need to be sensitive and realize your needs. But don't worry about the numbers so much as just really the pattern. As a woman ages, while their biologic egg contributes to lower fertility rates, using a donor egg will keep very, very high pregnancy rates for well into the late 40s. And then late 40s and early 50s, you're going to start seeing declines there. But the point being is that the uterus does not age reproductively. It's actually the eggs, okay? So that may give you some hope, all right? So to review, we talked about reproductive biology and obviously the ovarian aging effect. We discussed the implications of biologic clock and ovarian aging on fertility, and we offered ways to try to beat the clock using natural and medical methods. So I hope this was valuable to you all. It was an absolute pleasure to be with you virtually. Great success to you on your journey. My prayers are with you all. And I just want to leave you with this, is to realize that you are not defined by your ability to procreate and have a child, okay? You are defined by the person that you are, how you help others and accomplish and contribute to society. So my prayers are with you all. God bless and stay safe. Bye-bye.